So do you want to have the camera in the back? Well, good morning, everyone. Great to be here with Scott Carpendale, who is the Vice President and Managing Director of Boeing Defence Australia, and some of the 100 interns who will start an internship with Boeing this summer. They are Daisy, Abby, Keith, Sam and Ella. Now, we know Queensland's strong health response has enabled a powerful economic response to the pandemic. And of course that means that Queensland is creating more jobs than all other states combined. 90,000 jobs, additional jobs created in Queensland over the last 18 months. And Treasury now forecasts that Queensland will create an additional 120,000 jobs over the next 18 months to the middle of 2023. And with that growing workforce, with that growing number of jobs, we know we'll need a skilled workforce to fill those jobs in a range of industries. That's why these internship programs run by Boeing are so important. Of course, Boeing has had a place in Queensland, an important place in Queensland, for almost a quarter of a century now. It's a relationship that our government's worked on to strengthen and deepen and expand. And of course, it's resulted most recently in Boeing making a decision to manufacture and to assemble the first military aircraft in Queensland and in Australia for more than 50 years. That's the unmanned Loyal Wingman, which will be assembled in Toowoomba, an announcement the Premier and I made a little while ago. Of course, Boeing's place in Queensland is more than that. It's about providing pathways to those jobs that we know our state needs in the future. So not only are we winning when it comes to economic outcomes, not only are we winning when it comes to jobs, we're also winning when it comes to internship places. So of the 120 internships that that Boeing will deliver across the country this summer, 100 of those places will be in Queensland. I met some of the bright and brilliant young people who are going to take up those internship places, and that fills me with great confidence, not only about what Boeing can do for our state, but about the young people in our community, the young people who will be the powerful workforce that our state needs in those jobs in aerospace, in space and in defence industries in the future. So congratulations to all the interns on your positions. We know you're going to have a great summer. Congratulations to Boeing for looking to the future when it comes to the workforce Queensland needs, and thanks to Boeing for again choosing Queensland, because Queensland's the place to be. Now I'm going to leave it to Scott to say a few words. Then Dr John Gerard, the Chief Health Officer, is here as well, and he'll say a few words about where we are with COVID today. Thank you.
Thank you, Treasurer. As Treasurer said, very exciting day for us to be able to announce so many interns joining our workforce, and particularly having over 100 interns here in Queensland is a really important milestone for us. It's a sign of the continuing growth we have both in our industry more broadly, but certainly in the state of Queensland, and also the amazing talent that Queensland universities are presenting in a range of fields that are very important for defence and defence industries growth, focusing on engineering, commercial skills, and for the first time we have our sustainability intern within Boeing as we continue to grow our corporate social responsibility and the need for sustainability as a part of our future. Exciting for us, and we're really impressed with the continuing level of support from the Queensland Government for us to be able to deliver on a program like this. Thank you. Happy to take any questions.
So happy to take questions on Boeing first.
Was there an impact on COVID in terms of workforce or demand at all, and is that starting to pick up?
So demand certainly has been there. We've continued to be able to recruit actively over the last 2 years, and our workforce at the top line has grown. What we are seeing as COVID, we get towards the back end of the COVID pandemic, we're seeing continued growth in other sectors, and demand for jobs and competition for jobs continues to increase. We need to continue to grow our own workforce of the future, and that's why we're investing so heavily in internship programs so that we are able to build people with those skills and experiences within Boeing. A couple of reasons. One, we've got some great relationships with Queensland universities, and we have had for a long time. We've worked on the curriculum, particularly for some of the engineering degrees, to make sure that the interns that are coming through there have got the skills that are really attractive to us. Our headquarters is in Queensland, so the majority of the Boeing workforce in Australia is based in Queensland. So we want to make sure that when our interns join us, they've got access to mentors, coaches and leaders that can continue to develop them, and so that's obviously a natural fit for them to be based in Queensland. Great, thank you.
Okay, all right. Dr. John, do you want to do a quick COVID update? Thank you.
So we've just seen 4 new cases of COVID-19 in Queensland in the last 24 hours. All of them have been in quarantine, so they pose no risk. Now, 3 of these were from interstate, from northern New South Wales, and this is a pattern we've been seeing for the last 2 to 3 weeks of increasing numbers of incursions over from New South Wales, but these individuals have all been in quarantine. We've had 1 new overseas visitor in quarantine with COVID-19, and I can report that he does carry the Omicron strain. This was acquired in Kenya. This is a pattern we're likely to continue to see. If the experience from the United Kingdom is anything to judge by, we are certainly anticipating that Omicron is likely to become the dominant strain worldwide in the coming weeks and months. That is why it's so critical that we all continue on the vaccination journey. We know that we get good immunity with the current vaccines for at least 5 to 6 months, but I'm encouraging everybody, once they've reached 5 months after their second dose of vaccine, to get that 3rd booster, because we know with that 3rd booster that your immunity increases dramatically. It is quite critical, as we are likely to see more Omicron cases, that those people who've reached 5 months after their second dose get their third dose. Those people who are less than 5 months should have good immunity from their existing immunisation. The other thing I can say overnight is there's been a significant increase in the number of Queenslanders getting vaccinated. On the Gold Coast alone, we've seen a doubling in the number of people getting vaccinated just in the last 24 hours. Now, a lot of those people have been getting their 3rd dose of the vaccine because of the requirement now, or the advice at 5 months, and that dramatic increase in your immunity that you see when you get that 3rd dose. So at this stage, we've not seen any impact from the opening of the border. It's a little bit early to see something like that, but we're expecting that is inevitable, and it's something that we have planned for 2 years.
To clarify, none of those people have been infectious in the community in Queensland?
None of the 4 cases that we are referring to have been infectious in the community. None of this 4.
Dr. Gerard, the vaccination mandate for private sector healthcare providers comes into effect tomorrow. How will this be enforced, and how confident are you that the businesses across the state will comply?
This is for private healthcare providers. Well, it will be up to the individual providers to ensure that their healthcare workers are vaccinated. And given our experience in the public health system, I think it's likely that all of them will get vaccinated. There have been very few healthcare workers that have not been vaccinated. It's now become part of the culture. I think the hesitancy is melting away. Now, particularly now that Queensland is opening up and we're going to see the virus arriving here, that hesitancy is melting away.
There is a loophole for critical workforce shortages that businesses can have an unvaccinated worker working for up to 3 months. How can you assure vulnerable Queenslanders that all their healthcare providers will actually be able to provide a safe environment?
So these would be very small in number. We're talking about a small number of critical workers that for some reason cannot be vaccinated. These would be very small in number. I'm not aware of the numbers at all, but these would be very unusual circumstances.
And the Omicron case, where is that close from? I missed that, sorry.
This case was probably acquired in Kenya.
Yeah, okay. And are you, I think the UK are looking at redefining what it means to be fully vaccinated now. They're looking at percentage on a screen, so actually they're looking at like you've got to
Well, of course, the United Kingdom began its vaccination program much earlier than us, so they have a lot of people whose immunity is waning, whereas for Australians, for most of us, our immunity is still relatively high. But for those people who have reached the 5-month mark, that includes myself, we're all receiving boosters, and I would encourage anyone who has reached that 5-month mark, which will include quite a few vulnerable people. It will include healthcare workers. Now's the time to get that 3rd dose before the Omicron strain starts to spread in Australia on wide scale.
Sorry. Are you concerned by the growing number of cases in New South Wales?
Yes, I am concerned. At this stage, I don't think we've seen an increase in hospitalisations. But yes, we're certainly watching that with great interest. But it's not going to we're not going to deviate from our current plan.
Where is that Omicron case at the moment, that patient?
They are isolated in hospital in accordance with the current guidelines. I'm asked not to name the hospital where they're isolated.
What do you think it would take for the drive to trigger, say, a mask mandate being cases taken off in New South Wales?
We are looking at mask mandates on a daily basis. Certainly, if there is evidence of community transmission of the virus, mask mandates are likely to come back in. Indoor mask mandates. It's probably a little warm in Queensland for outdoor mask mandates, and they're probably not so critical. And we're looking at that on every day. We look at that. At this stage, we're not finding evidence of sustained community transmission. So it's probably a little premature, although there is argument on either side. There is some argument that nationally we should all just be wearing masks now, so we are looking at that and discussing that actively.
A number of hospitality businesses are planning on closing when the mandate comes in on Friday, and they're hopeful that once we hit 90%, that mandate will disappear and they'll be able to open again. Is that what's going to happen when we reach 90% of all those mandates?
We are not even looking at removing the mandate. It's not even something that's on the agenda, so that is not a good plan at all. It's not on the agenda at all. The immediate priority for the unvaccinated is to protect them from infection, and that means to keep unvaccinated people away from crowded environments, because you'll remember that these hospitality locations have had a lot of their restrictions lifted, so vaccinated people can live their lives normally, and it's not fair on the vaccinated to ask them to make sacrifices for the very small number of people who have not become vaccinated.
Some of those businesses are planning on sort of seeing how far they can push the line with the mandate, going to takeaways only, maybe selling their products and people can go and eat them in a park across the road. Is that just defeating the purpose of what the mandate's?
No, there are details in the instruction of what is and is not allowed, but the general principle is we don't want unvaccinated people in crowded environments where they can acquire this infection. It's not in their interest, it's not in the interest of the people around them, and it's certainly not interested in the interests of the healthcare system, which could well become overwhelmed if we have too many unvaccinated people being admitted to hospital. Certainly with the existing strains of the virus, and Omicron is new to us, but with the existing strains of the virus, vaccinated people, by and large, do not get very sick at all and do not end up in hospital. Now, we're still learning about Omicron, so I don't want to say too much about it, but it looks like the vaccines are likely to be effective, particularly with that booster at 5 months, but it's still early days.
Question for the Treasurer, if that's okay.
Sure.
So a number of these hospitality businesses said they're already facing staff shortages, especially chefs currently are hard to win. And then when the vaccine mandate comes into effect on Friday, they're worried they're going to lose even more staff. What's the plan to fill those gaps?
Well, that'll be a matter for business to make a decision about how they operate their businesses going forward. But what we do know from places like New South Wales, where arguably the restrictions are slightly tighter, particularly in the second week after you've been in close contact, we haven't seen large broad-scale closure of businesses. So the experience of other jurisdictions, I think, indicates that we'll be able to continue. Business will be able to continue to operate.
Wales is removing its requirement of proof of vaccinations tomorrow, 2 days before Queensland brings it in. So in light of that, do you think it's actually justified to have that imposition on business owners now?
Yes, I do.
Treasurer, some businesses have been targeted like early online, they've been controlled online by anti-vaxxers. And is there anything?
Well, there's no place for any abuse of anyone in business, particularly hospitality workers. There is no one deserves a serve, regardless of where they work, whether it be in retail or hospitality. And people have got to understand that the decisions we have made all along have been careful and cautious, and they have kept Queenslanders safe. That's been our priority. When you look at the devastation that COVID's caused in other states, there are more than 500 people who will not be around the dinner table at Christmas this year in New South Wales alone, more than 1,000 in Victoria. They're families that won't have a loved one with them because of the devastation that COVID has caused. So we have been very careful, very cautious and very targeted in our measures to protect Queenslanders. And when we've only had 7 people, very sadly, who passed away from COVID, half of those broadly referable to the Ruby Princess, I think that demonstrates we've had a world-leading response, a world-leading health response to COVID. And now we're seeing the economic dividend that comes from that. So these measures are very carefully thought through. We're implementing them now, and we're going to work together as a state to get through the next phase as COVID is introduced to Queensland. Sorry? Damani, nice try, but all will be revealed later in the week when I do the budget update.
Now I've had a handful of press conferences since the budget. Now this week we've seen you on Sunday, we've seen you today, we're going to see you again on Thursday. Is that a sign that we're in good shape?
Well, nice to see you too, Lydia. We do what we do in accordance with a plan we have as government to speak to the people of Queensland. We do that every day, and I've had a great announcement here today. That's why I'm here with these brilliant young interns.
Will you just clarify on those jobs, 120,000 a year, over what time period was that? Sorry.
To the 18 months to mid-2023.
Did you lobby the federal government to build an mRNA facility here in Queensland?
Well, I was delighted to see today that the federal government's decided to manufacture mRNA vaccines in Australia. This is exactly what I called for in 2016, and now Scott Morrison is somehow claiming credit for this. When I raised this with the federal government in 2016, that we needed a sovereign vaccine manufacturing capability in Australia, they laughed at me. So for Scott Morrison now to claim that he is leading the nation is in fact laughable. I mean, the reality with Scott Morrison is you cannot trust a single thing that this bloke says. I mean, now he's undermining the check-in app. That's what he did yesterday at the speech at the Sydney Institute. Now, test, trace, isolate, they have been absolutely critical parts of protecting Queenslanders and protecting Australians. They've been adopted by every jurisdiction. And of course, tracing is a critical part of that. How do we do that? Through the check-in app. And now he's criticising that. I mean, the reality is most of the world would have very much liked to be in Queensland's position with 80% double-dose vaccination before the virus was introduced. In New South Wales, they were only 4% double-dosed. So for some reason, Scott Morrison now wants to undermine the very protocols that have kept Queenslanders safe, and he calls this leadership. I think it's not leadership. I think it's laughable.
Did you actually lobby him to build?
No, this is a decision. This is a decision the federal government has made. Now, I would have loved for the national government to have done an open tender process with all jurisdictions. It's exactly what they did with mask manufacturing when I was the State Development Minister and the Manufacturing Minister at the beginning of the pandemic. All of a sudden they announced a manufacturing investment in South Australia. And I wrote to the then Manufacturing Minister, who was a Queenslander and is a Queenslander, Karen Andrews, to say, what is the basis for your investment decision in South Australia? That goes back 2 years now. I said, all states need to be able to participate in this. We need to have a chance. What are your tendering protocols? And I heard nothing. And so this is a decision the federal government's made. I think the nation needs a manufacturing facility of vaccines. That's why I called on the federal government to do it 5 years ago. I'm just sorry Queensland wasn't given the opportunity to participate in this. But we'll look to expand our biomedical space. It's where we're doing work at the moment with, of course, needle-free vaccination through companies like Vaxxus. So there's a lot of work we're doing as a state. We'll continue to do that.
High coal prices and a bump in stamp duty be enough to offset some of those key assumptions that haven't come true in the budget, like borders staying open. Is that going to be enough?
Lydia, I'll have great news for you later in the week when I release the budget update.
Will debt increase?
I'll have some great news for you later in the week when our budget update is released.
Do you think it's acceptable for Alicia Killer to be living next door to her parents in Queensland, given he's under the watch of corrective services?
I'm not aware of that, Tim. Sorry, it's the first I've heard of it.
Will you accept a coal royalty freeze?
Lydia, I'll have more to say on that later in the week, but I've been very clear to you previously on that.
So you will have an answer about coal royalties?
No. We provided you with a clear response, Lydia, which you have published. So I don't want to reopen that today. Well, I provided you with a response. Tim.
Senior government minister, do you think Alan Warren's job is tenable?
The government will consider the report of the parliamentary committee, as the Premier said, and until then, when we do that in the new year, we're not going to comment further on it.
Last question.
I'm working through the report. Some very significant observations made by the committee, but all cabinet ministers will read the report. We'll work through that and we'll consider that, as the Premier said, in the new year.
Can I just ask another one on COVID quickly? With those 5-day PCR tests, is that actually going to be monitored that every traveller who's come into Queensland will definitely be chased out and checked that they've done that 5-day test?
I might let the Chief Health Officer respond to
A
that.
very quick question about the Olympics. Would you like to see the Inala Paris having its opening ceremony on the river? Do you like to see that same thing happen in Brisbane here?
I think on the river. It's the first I've heard of that too. Of course, we have one of the most beautiful and important rivers in the world in Brisbane. So we'll look forward to how we use that river in the Olympics. But certainly, I think the experience, when you look back at places like Sydney and London, using the river through the city, having daily night shows, or night shows every day, lighting up the river through pyrotechnics. I think that would be a wonderful thing for our city, and you could run it all the way through from the headwaters down to the bay, and I think that would be a way to highlight the importance of the river. But we'll look at all of those things, Tim.
All I can say with regard to the checking is that it's currently being looked at about how best to follow those up. So I have no more information about that.
Well, I mean, it's happening in 4 days, so when will there be some kind of definitive advice about whether or not you'll be checking to make sure that
I will keep you informed when we learn more.
Thanks, guys. Thank you. No plans to change.